as to what they intend to do. Let's delve into the details of what they intend to do. What does it say?
Yeah, Dave, before we go, we get into what they have to do. We normally backtrack a bit and go to the past manifesto to see what they said.
Yeah.
Then you, the listener, can judge for yourself what they've done. And based on the trackings I have done, there were 13 promises in the 2020 manifesto when it comes to health. The first one they said was that they will focus on health promotion and prevention as part of primary health care through the National Health Insurance Scheme to achieve universal health coverage. 2, they will review and overhaul healthcare financing. 3, deliver on the biggest healthcare infrastructure investment by any government in the last 50 years by undertaking Agenda 111, previously Agenda 88 project. Then they said that they will construct infectious disease center for each of the 3 ecological zones: coastal, northern, and middle belt zone. Dave, I can report that the only one I know of is the one senior Hosi and team built in Accra. If you know of any infectious disease center in the northern Ghana or in the middle belt, meaning Ashanti and the Bono regions, please let us know when you open the phone lines. 5, complete the ongoing hospital project and related expenditure. Infrastructure. For that, we can say there's been some work there. Complete the ongoing digitalization of medical records through patient record management system, e-health solutions, and health information management system, and health analytics to improve quality of patient care. For this one, Dave, recently when an acquaintance was at Tech Hospital, the pharmacy and everything is linked. Now they don't do the paper, everything. They have a certain software they are using. That's my experience at Tech Hospital. Then 7, harmonize the functions of the HEFRA, which is the Health Facilities Regulatory Agency, the National Health Insurance Authority, NHI, Pharmacy Council, and non-professionals regulatory body with respect to facilitate facility licensing, accreditation, and credentialing under a common legislative, regulatory, and infrastructural framework. For that one, to the nurses should tell us. I don't have facts on that. Then 8, expand access to medical schools in Ghana by building additional facilities and augmenting its human resource base.
Take that bit again for me. Expand
access to medical schools in Ghana by building additional facilities and augmenting its human resource base.
Does the Tech Hospital, the teaching hospital, come into this one?
Yes, you can argue.
I can argue that it should come into this one.
Because the teaching hospitals comes in to help.
And then we have said it when we talk about abandoned or stalled projects, that because of the fact that they don't have enough space, they are not able to, the intake for medical students hasn't gone up.
They'll give you pharmacy and all that.
So they haven't done that to some extent based on this.
Yes, I don't think they've even done it, but let's leave it to health question. I don't have the full facts on that. 9 says that work with the Ghana Medical and Dental Council to streamline the admission process for foreign trained doctors. Dr. Frank Sebo should help us with that. 10, support the development of traditional medicine. 11, whilst supporting the private sector to ramp up production locally, we will eliminate import duties on sanitary pads to improve health outcomes, particularly for girls.
Again, take that one again for me.
While supporting the private sector to ramp up production locally, we will eliminate import duties on sanitary pads to improve health outcomes, particularly for
when girls. It comes to sanitary pads, you and I know the campaign we do here. And the fact that we're talking about the fact that, even the taxes on the sanitary pads is making it next to difficult for many people in the rural areas to afford it. Even in Parliament, some members of Parliament have raised concerns about the taxes on sanitary pads. And they have championed that. Why don't we take away these taxes on it? It's still on it.
One of the budgets, they did say they would take some taxes and also the raw materials. I have to check what has happened to that province.
But even Hamda, who's into production locally, who's into production of these parts locally, has she been identified? Is she being assisted?
In fact, yesterday I was saying that I wish you get to a point where sanitary pads are as cheap as condoms and post pills. So I decided to do a survey at Tremat. And I still realized that the price at last year of sanitary pad is almost the same. So there's not been, so if the duties have indeed been reduced, it should reflect in the cost.
Isn't it a shame that we still rely on imports on things like sanitary pads?
Well,
that is why that bit where Eugene read, I asked him to read again. Because that was a promise that was captured in a manifesto. What has happened to it? He's saying that he's hoping that we get to a stage where sanitary pads will be as cheap as condoms. I'm also praying that it will be so common that if a woman goes to, let's say, a washroom somewhere, sanitary pads are available.
We are not there yet.
I'm saying that I'm hoping that we get there. But sanitary pads are available. So when you go to the washroom, you realize
They
actually.
have the washroom to talk of. Get putting pads in there.
No, sometimes I hope we get there.
But if you can start experimenting with the lights, okay, anyway. Okay, for example, they have some digital washrooms. For example, the Department of Architecture, that area, the built environment, there's some washrooms you have to use a card to enter. Or they can start experimenting with these campuses, the SHSs and all that. Then maybe they can go to the market washrooms and all that. With right sensitizers, could be back on time. Dave, I told you.
But these dispensers, sometimes it is done in a way that you cannot have
access. Me, Eugene Osei Tutu, about 3 years ago, we did a project with open societies for something was at Osiwa, where we gave dustbins. We did the cementing, then there was a metal something the dustbins were in. When we went back after 2 weeks or so, some of the women told us their mates have removed it. Somebody could say
no, but again, this is not surprising. It's not surprising, but because you and I know that even when it comes to transformers, when we go to our streets, those aluminum balustrades, people are removing the nuts and stealing them.
Yes.
So that's why yesterday I was saying that, listen, as Ghanaians, we need to have some kind of reorientation of our minds, such that I don't have to steal this because it's for a greater good. When we mentioned the farming bits, where we should have some national farms, and Leo mentioned that we work with Chabot in Mediaco. We are in La Côte d'Ivoire, like somebody called them, was saying, in La Côte d'Ivoire, they have a palm plantation. Nobody's saying I'm going to cut one palm fruit and take it home to go prepare my banquet.
You see, how hours. Let's talk about the 13th promise. This one, the 2020 manifesto. Continue to recruit trained health personnel and distribute them equitably across the nation.
And yet we have health professionals who are sitting home, nurses and all that. They're still sitting home.
The portal for them.
Since when?
The 2020, but they've opened the portal for them. So now what is outstanding is the 2021,
2022,
2023. So there are 3 badges of nurses that's outstanding. There were 4. So yeah. Then said that focus on telemedicine to enhance delivery. So he can say that the e-pharmacy and the zipline thing. So this is the 2021. Now in 2020.